frame and share, sir. Uh, Please tell about cervical cancer.
So cervical cancer, it is commonly called as cancer cervix. It is a cancer or a malignancy of a cervix. And what is cervix? Cervix is the opening of the uterine cavity. So where uterus opens, it is a cervix. And the cancer of this cervix is called as a cervical cancer. And why does this happens? Because this is the second most common cancer after breast carcinoma, where the women are dying due to cancer cervix. Its prevalence and incidence is also increasing. So we are very worried. But the good thing about this patient of cancer cervix is that they can be easily predicted for development of a cancer. They can be screened before development of the cancer. And if you predict and screen before development of cancer, then 100% this cancer cervix is preventable.
Sir, what is the main cause of cervical cancer?
Now, why does this happens, cervical cancer? So, most commonly thing which is named is the HPV virus infection, that is human papilloma virus infection. There are more than 200 types of human papilloma virus infection, out of which 16 and 18, these are the viruses which are highly infective, they are likely to cause malignancy. Other human papilloma virus infection cause malignancy of genital tract, then venereal warts, malignancy of the throat, oropharyngeal cancer is also common, and this is there for male and female also. So this is the first cause. Why does this infection occurs? This infection occurs if there is a intercourse before early age, means if the marriage is earlier, or if there are multiple pregnancies, or patient is having promiscuous behavior or unsafe sex. So this is likely that this cancer is this HPV virus is transmitted through intercourse and skin to skin contact. So 80% of the women are exposed to human papilloma virus of different types. So those who are exposed to 16 and 18, if you screen them, you can be preventing the CA cervix.
At what age it occurs?
Yeah, now what happens that once this human papilloma virus get infected, the cancer does not occur immediately. It requires its longevity. Around 10 to 20 years is the period where the cancer occurs. So it gives lot of time to treat it and recur and reverse back. So once HPV virus infected, all patients are not going to be cancer. Only few patients who are having less immunity, they are going to get a cancer in 4th or 7th decade.
Government had decided to give HPV injection, human papilloma virus, for cervical cancer prevention at the age of 14.
Yeah.
Tell us about that.
Yes, so now this is a welcome step by the government of India that they are giving a HPV virus, and that is a CA cervix immunity vaccine, and this is given to the girl child, and it is given to around from 12 to 14 years of girls of this age group, and this is going to prevent two types of infection, that is 16 and 18. That is a dual marker, and this is most common for CA cervix. If a girl get this vaccine, minimum 10 years she will not have any infection, and there is no chances of CA cervix. So it is a welcome decision that we are giving a free immunization to the girls of this age group.
Sir, what are the effects and results?
Yeah, now most of the thing this happens that when a new vaccine comes, there are a lot of rumors go around this. For example, vaccine also there were, for COVID vaccine also there were rumors. So for this HPV vaccine also there is rumor, but take it from this that the vaccine is used in India after 20 years of trial in the Western countries. Western countries are using it already, but now we are using this. So in 2017 only the Western countries used. There is no any serious side effect found. There is no result of any infertility. People are saying that it's a bachcha hoega nahi, infertility. It is not that. It is not no way related to the infertility. The girls are not having any side effect. The side effect which you can say is like any other injection, just pain and little this thing. Otherwise there is no side effect. It is totally free and a very good vaccine.
What message you will give to the women?
Yeah, the message which I want to give through this is that the HPV vaccine is very good and very safe. All girls who are eligible for getting HPV vaccine, they should get it. Only 2 doses are required, and they should get 2 doses completely, and they should not fear about any side effect of this. It is not going to affect them in other way. On the contrary, you are going to 100% protection of CA cervix, and you will have a very healthy and quality life ahead.
Thank you so much for giving a precious time to Frame and Share. Thank you so much.
Thank you.